It is yet another beautiful Friday. I welcome you. Thank you for watching Family Television. Of course, this is a station that enriches your lives, and we are really glad that you're still following us even in this new year 2021. Thank you so much for the time you dedicate to choose to watch only Family TV among the many stations. But of course, this is Health Pot. This program is targeting mothers and mothers to be. So if you are a mother or a mother to be, then you shouldn't miss any of these programs. It is actually specifically handling maternal health. So when you talk about maternal health, you know it is basically for mothers and the would-be mothers. You shouldn't miss every Friday at exactly 7 p.m. We are right there in your living room. But of course, I'm Edrine Mukalazi, together with our guests today. We have Dr. Sarah, who is going to take us through today's topic, and we also have Fatna on sign language. But of course, I welcome Dr. Sarah to greet our esteemed viewers. Doctor, you're most welcome.
Thank you.
Yeah.
I'm Sarah Namutamba. I'm here to discuss with you or to share with you issues to do with birth preparedness. Thank you.
Thank you so much, Doctor. You've talked about birth preparedness. How can we, or how can you break down birth preparedness? How can you explain it to the viewers so that it can be now something so simple in their minds?
Thank you so much, Eddie. As I've told you, our objective today is to help the target audience to understand the influence of birth preparedness in deciding where to deliver from by the pregnant mothers. We are going to help our target audience to understand that birth preparedness has great influence on decision making for the pregnant mothers where they are supposed to deliver from. We shall be talking about birth preparedness in detail, and we shall also be explaining how birth preparedness influences decision making on place of birth by the mothers.
Okay. So I think we shall start with the definition of birth preparedness. What is birth preparedness itself?
Birth preparedness, it encompasses a process of planning for normal birth and also anticipating the action is needed in the case of an emergency. I want you to mark the word process, which means it is not a one-time thing. It shouldn't come as an accident, but it's something which takes time. When a mother conceives, God made it that it takes full 9 months for the baby to come. So it means once you realize that you have conceived, you have to start preparing for birth. That's what makes it a process.
So do we start from the time you've conceived, or it starts from a few months of pregnancy?
The moment you realize that you have conceived, start preparing for birth.
Even if you're 1 day pregnant?
It is hard to know that you're 1 day pregnant, but at least in the first month, most women get realized that they are pregnant after missing the first period. So within that 1 month, start preparing for birth. I am going to explain what a woman is supposed to prepare. What does birth preparedness involve? It is looking at preparing for birth. There is that minimum package, the minimum basic items that a woman must have when preparing for birth. I'm calling it minimum because it is not all. When you go to the health facility nowadays, they give you a mother kit, a mama kit. That mama kit is the minimum a woman should have when preparing for birth.
So maybe, doctor, we can also talk about what is involved in the mother kit or mama kit.
In the mama kit, we have items like gloves. We have items like the cord ligatures. We have items like the polythene sheet, that kavera which you put on the bed to avoid, to maintain hygiene. We have items like the baby's clothes, because if you have delivered a baby and you don't have clothes to wrap them in, they can be affected by the cold and eventually they fall sick and die if you don't take care of them. So you need to have the clothes with you, the baby's clothes.
Doctor, these clothes are part of the mama kit, or it is the mother now to have them?
They are not part of the mother kit. That small mother kit, sometimes they put a towel. Sometimes they put a towel, which they can use to wrap a baby immediately the baby comes out. But the mother is also supposed to prepare the baby's clothes. Yes. So I've talked of a mother kit, which has the basic items. But there is also a lot that you need to prepare beyond a mother kit. And sometimes you can go to a health facility when those mother kits are out of stock. So you don't have to depend on the health facility. You have to prepare such that if you go there when the mother kits are out of stock, you have yours at hand. Yes.
Yours as hand as a full pack of the mama kit, or these requirements, each are separate? The items you've talked about that are involved, that are in the package of a mama kit.
You need to have all the necessary items. You need to have, of course, the mother kit has a few items, but there are other items that you need to have. You need to have soap. Sometimes it is in the mother kit, sometimes it is not there. You need to have your own.
Which kind of soap? This ordinary laundry soap, or?
Yeah, for an ordinary woman who is a low-income earner, you can have bar soap in your mother kit. Yes. You can have a piece of bar soap, which is around 2,000 shillings, Uganda shillings. Yes. So I've talked of the gloves, the polythene sheet, the cotton, your personal effects. You also need to prepare a number of things. You need to prepare to save some money in the case of an emergency.
Maybe, doctor, before we go to the money, I want us to exhaust these items, because when you talk about personal effects, someone might not understand what these personal effects are exactly, because they differ depending on who is preparing what.
Yes.
Yeah. So I want us to exhaust these personal effects.
So the personal effects, now let us look at an ordinary woman.
Yeah.
At least you need to have another pair of a set of clothes to change after delivery. You need to bathe and dress up and maintain hygiene and cleanliness. So at least you should have another cloth to change after delivery. Then you should have items like a basin. Yes, you should have, when you go to the health facility, they will not give you a container to fetch water with. You should have a jerry can. You should have sugar. You should have tea leaves. You can also have, like I've told you, the money, some money. So you have to save some money. That in case there's something that requires finances or to spend some money, at least you are already prepared. Okay. Yes.
So let us now go to money. What is the minimum amount that someone is supposed to have in their pockets as they're preparing as they're in the process of birth preparedness?
I wouldn't want to talk about the minimum amount, because these costs differ. I may tell you that you prepare 100,000, and then to somebody that is a lot, and can chase them out of the what? the hospital. But at least you need to know where you're going to deliver from in the first place. So how much is required to transport you from that facility, from home to that facility. And if you are going to a lower level facility, at least you need to know where the hospitals are. That in case you are not able to deliver from a lower level or a health center per se, or a clinic, a nearby clinic, you need to know how much is it from that clinic, how much is it from that health center to a hospital. That is if it requires that you deliver from a hospital, such that you save that amount of money. Yes.
Okay.
Yeah.
So besides money and then the personal effects and the mother kit, what else does a lady need?
Yes. A lady need also to prepare her husband. You need to, you know when you are pregnant. Let me start from before a woman gets pregnant. Everybody is concerned. Is she pregnant? The in-laws are concerned. The husband is concerned. The people around home are concerned. So that same concern they take to know whether the woman has conceived or not should be the same concern when the woman expressed when the woman is in labor or when the woman is pregnant, such that they support her to prepare. So the husband and the wife must be together when they are preparing for birth, including the family members, because they are going to help this woman to know which facility she's supposed to go to. And maybe some of them are the ones who manage the finances. I'm talking about this ordinary woman. I'm not talking about the already empowered women, those who have the money. But I'm talking about this ordinary woman who needs support from the family members, such that you need to prepare the transporter, because labor may start at night when the transporter is sleeping, and sometimes they switch off their phones. So you need to inform this transporter that the times I've been going to the facility, they've been telling me for antenatal care, they've been telling me that I'm likely to deliver in such and such a month or in such and such a week. So please be available for me around that time. You also need to prepare, you and the husband, to prepare for an HIV test. Because when, for example, if you are HIV positive, you need to test such that you prevent your newborn baby from contracting the HIV virus. So you need to prepare for that test.
Maybe, Doctor, before we leave that test,
yes.
Is it only HIV? Can these other infections that a mother can attract on the way affect the newborn baby?
Yes, there are other infections which can affect the baby. So when people are going for antenatal care, at least they are prepared. They are tested, they are treated, and it would be good. Maybe if you have any other infections, maybe like STDs, both of you get the what? The test and the treatment.
So, Doctor, maybe at that point, we are going to go for a commercial break, and then when we come back, we shall continue with the birth preparedness. We are coming back shortly after the commercial break.